Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Welcome back to the Clean Collective segment brought to you by Society Brands and Primal Life Organics. Parents, here's a wake-up call. Your mouth is the gateway to your body, and what goes in it, from the products you use to the treatments you're told are safe, can have ripple effects on your overall health for decades. According to the World Health Organization, poor oral health is linked to cardiovascular disease, diabetes, respiratory infections, even adverse pregnancy outcomes. And yet, dentistry still promotes certain practices like fluoride treatments, mercury amalgam fillings, and root canals that many biologic dentists warn could be doing more harm than good. Our guest today has dedicated her career to pulling back the curtain on these exact truths. Dr. Rachaele Carver is a board-certified naturopathic and biologic dentist, combining conventional dentistry with nutrition science, energy medicine, homeopathy, and leading-edge therapies like PEMF and ozone. She's also a healthy start provider, identifying early signs of deficient jaw growth and dysfunctional breathing in children, often before they become lifelong problems. Her mission is very clear: to treat not just the symptoms in your mouth, but the root causes, no pun intended, that affect your whole body. Today, we're chatting about the lies about fluoride, fillings, and root canals, and how they're impacting our family's overall health. Dr. Carver, welcome to the show, superstar.
Thank you so much, Zen. I'm very happy to be here.
So this is something that has fascinated me as a mom, because the minute I gave birth to my daughter, everything was a research, right? So we've been told for decades that fluoride is essential for preventing cavities, but many dentists in your field, the biologic ones, are raising concerns about its safety, especially for children. And if you look further, the research is there. The CDC itself has warned about dental fluorosis from overexposure. So what's the real story on fluoride, and why should parents think twice before automatically accepting fluoride treatments for their kids?
Yes, this is a great question. And it's been in the news a lot recently because of a national lawsuit that was just litigated last year, the end of 2024. Finally, that lawsuit ended with the EPA basically getting a slap and saying, you are not doing your due diligence. There is enough evidence to show that having too much fluoride causes neurocognitive defects, right? So lower IQs. Fluoride was a byproduct of the war industry. And at the end, they're like, oh my gosh, what are we going to do with all this stuff, right? And so it got put in the water supply, and hey, this is going to prevent cavities, because before that time, there was a dentist out in Colorado who noticed that his patients, they had modeled like white spots and brown spots all over their teeth, which is what you mentioned, this fluorosis happening.
Right.
And they noticed, it doesn't look very good, but hey, these patients aren't really getting many cavities. So they decided from that fluoride prevents cavities. Unfortunately, the fluoride that is added to most water supplies is a chemical byproduct. It's not the sodium fluoride that you might find in a toothpaste, or there is naturally occurring fluoride. That is true. But it's not what is getting added to our water, and sometimes not what's in all of these dental products and these toothpaste. So, if you look on the back of your toothpaste, it says, call poison control if swallowed.
Yes.
And the problem also, fluoride is in a lot of prescription drugs too. So the dose we're getting of fluoride is way too much. And especially, hopefully our children are on prescription meds. But the idea is that fluoride kills bacteria. So it works by being antibacterial. And I think now that we know, everybody's learning more about the gut and overuse of antibiotics, how that's creating a problem in our lower guts, right? The mouth is really the upper gut. So same thing. Again, we don't want to necessarily kill bacteria. We want to create health in the body. And we'll talk a little bit more about how we do that. But fluoride is also associated with thyroid disorders, right? Because fluoride is a little bit heavier than iodine, which is needed for the thyroid. So we're seeing tons of hypothyroidism in the world today, and fluoride is a contributor to those hypothyroid problems.
What you said is very eye-opening, because for so many parents, fluoride feels like a given, not a choice, and understanding the risks changes everything. So thank you. Now let's talk about the mercury filling myth. So silver amalgam fillings, which contain about 50% mercury, are actually still used in many dental practices. even though mercury is one of the most toxic substances known to humans. And the WHO states that there is no safe level of mercury
Correct.
exposure. So why are mercury fillings still being used? And what should people know before agreeing to them or even having them removed?
So the bottom line, like many things in this world, comes down to money, right? Amalgam is very cheap. And more dentists are not learning how to use it. I'm not sure how many dental schools are even still teaching amalgam techniques. But I know it's still prevalent in the military, and it's prevalent in clinics where there's, Medicaid funding. And unfortunately, it's because it's less expensive, and, it's pretty easy to do. When you're using the resin or the bonded restorations, the tooth colored fillings, they are more technique sensitive. They're more expensive, but they don't have any heavy metals. The problem today is we have over 80,000 chemicals in our environment. And a lot of those we can't control, right? There are things that are in the air, in the water. We can't avoid those kind of things. So any toxin that we can avoid, like an amalgam, like, say perfumes or certain, beauty care products, we can avoid those, right? So those are the things that we need to become aware of and try to avoid that getting in our, big bucket, basically, right? In our body. I think a lot of disease happens because we fill up our bucket, it becomes overwhelmed, and then it feels like all of a sudden we have symptoms, but we've really been building them for quite some time.
Now let's talk about root canals and the systemic health. So root canals are one of the most common dental procedures, but research, including studies published in the Journal of Clinical Microbiology, has shown they can harbor bacteria that may contribute to systemic illness. So what's the controversy around root canals, and what biologic alternatives should patients be aware of?
What we don't realize is teeth are organs. They have a blood supply, a lymph supply, a nerve supply. It's not just a mechanical feature of the body to chew. And every single tooth is connected by energy pathways to every other organ in the body. So again, very important to think about our teeth. We kind of separate the head from the rest of the body. Same with the eyes, right? Why do we have separate eye and dental insurance? It's all one part of the same body, but, regardless. So I also tell people a lot of times, it's like when you have appendicitis, right? We don't open you up, look at your appendix, scrape it out, put some rubber in it, and then shove it back in your body. That's basically what we're doing for a root canal. We're exposing the innards of the tooth. We're rinsing it out, sterilizing it as best we can, putting some rubber in and sealing it off, right? So again, it's great because the pain goes away. However, there are main canals, like a tooth, a molar, right? A back tooth has like 2 roots, basically, right? So there's main canals going through each roots, and there can be up to 4, sometimes even 5 canals per root. But then there's about thousands and thousands of other side roots, right? So when you're cleaning out the tooth with standard root canal procedure, there's no way to guarantee that all that disinfectant got through all those other side channels, right? So bacteria can hide in that. The other thing is with a root canal tooth, now that it's dead, there's no longer blood supply there. There's no longer nerve supply. And if anybody knows anything about energy medicine, the frequency of a dead thing versus a living thing is very different. So the energy in that area changes, and it actually will attract bacteria, viruses, parasites, Lyme, you name it. All those kind of bacteria can go and sit up in that area, and they love it, right? Because now there's no blood supply, so there's no more immune surveillance happening there. Now, I also don't believe that every root canal is bad, okay? It really, really depends on the person. So as I mentioned before, if you are someone with a lot of autoimmune problems, cancer, any kind of chronic ailment, then I caution you to think twice about doing a root canal, because again, that's an area that can harbor those kind of toxicities. And again, not easily detected in a blood test or something like that.
Right.
So, but, if you're young, if my patients choose, I always give them the option. Here are the pros and cons. Here's the benefits. And then tell them, they have to make their own choice by saying it's kind of like a temporary measure. So maybe you'll get a couple years about it. But if any health starts to decline, we need to look at that root canal and potentially remove that.
Yeah, that's the kind of information people really need before they make a lifelong decision about their health. Something so minor, but yet so life-changing. And knowledge is power. So it's extremely important to keep this education alive. Now, let's chat about oral health and child development. As a mom, this sits, at the forefront of everything I do, because the size and shape of a child's jaw affects not just their teeth, but their breathing. I know I'm going through this currently with my 9.5-year-old, and her sleep and long-term health, right? It's all affected. So these signs are often missed until it's too
Yes.
late. So
Yep.
what early warning signs should parents look for in their kids, and how can early intervention change the trajectory of their health?
So evolutionarily, our jaws are not growing wide enough and they're not growing forward enough. And so everything is getting kind of shoved back into the airway when that happens. A lot of kids have tongue ties, and there's the obvious tongue tie that's on the tip of the tongue, but there's something we call posterior tongue ties. It's a little farther back. So what does that matter? The tongue is what creates a wide, flat upper jaw. This is called the maxilla. So the upper jaw, the wider and the flatter and the more forward it is, right? The tongue is supposed to rest flat on the roof of our mouth. And the pressure tongue is one of the strongest muscles in the body. That pushes forward. And again, the sideways motion of the muscle there will create. And so then the teeth will naturally come in straight, right? We think, oh, it's just genetic. And yes, the genetic plays a big role in facial structure. But again, we can overcome certain genetics, the whole idea of epigenetics, right?
Right.
If we put in the proper input, we can get a different result. Having that nice wide upper jaw, also, that's the floor of the nose. So that expands the nasal passages. It is absolutely vital that we breathe through our nose, right? Mouth is for eating, the nose is for breathing. And if we are constantly breathing through our mouth, we're going to get that Napoleon Dynamite face, the very long, drawn out, dark circles under our eyes, very unhealthy looking face, versus the nasal breathing is that caveman, right? The really square jaw, big round face is what we're looking for. So in a child, what you want to look for is, again, are the teeth crowded? In baby teeth, ideally, there should be very large gaps between the teeth. Because imagine, right, your adult teeth are much larger than baby teeth. So we've got to have that space. So that's the number one key. Is there space there? The top and the bottom teeth, the way they overlap, you should be able to see 90% of the bottom teeth when a child shuts their mouth. And a lot of times, if the jaw, you could have what we call a deep bite. If when the child closes their teeth together, you can't see any bottom teeth, that's considered a deep bite. That means that lower jaw is too far back and is going to be creating all sorts of airway issues. So that's another ability sign. Your child, if they have dark circles under that. I had a mom yesterday. She's like, "Oh, I just thought that was genetic, like it runs in our family." I was like, "Oh, no, it's an airway problem." Also, baby teeth, if they're very, very worn, right? They say, "Oh, well, that's okay because they're going to fall out." But no, baby teeth should never be worn. That's another sign that the child is grinding forward, trying to open their airway. If they have, bedwetting, ADD, ADHD, those are signs of not enough airway. So in children, if you can't breathe well, you're not going to release the antidiuretic hormone while you sleep. So the kid's going to wake up. They may have to go to the bathroom. Or my youngest, she used to wake up in the middle of the night all the time. I didn't really understand this until years later, why that was happening. She had a very narrow airway. I finally realized, and we were able to expand her airway. So there are great dentists out there. There are several companies who make special they're basically like night guards, but they create good expansion. And ideally, from 4 to 7, that is when kids undergo the most growth. So if we can intervene in that, and again, I've expanded people in their 60s, so it's never too late. But that is, if you can get to somebody in that time frame, you'll hopefully prevent any braces. You'll, not only have a beautiful smile, but you have great, breathing and good brain activity.
Now let's talk about the mouth body connection. So can you explain how oral health impacts the rest of your body, and why moms should be thinking about this for not just ourselves as much, but for our kids?
Absolutely. So as I said, right, the mouth, everything's connected, right? And this is the beginning of the gut. The same tissue that lines your mouth is what lines your esophagus, your stomach, your intestines, right? We know that is one cell layer thick. So it's very easily damaged by toxins, bacteria. Every time you swallow about 2 liters of saliva a day. So if you've got a lot of bacteria, a lot of toxins, you're swallowing that directly into the lower gut all day, every day. Every time you chew, if you have bacteria underneath your gums, so if you have red bleeding gums, that's a sign of inflammation. Every time you chew, you are pushing that bacteria directly into the bloodstream. So even, 23 years ago when I was in dental school, we learned about, the oral bacteria and heart disease. I gave a lecture back in March or February, Heart Health Month, about how oral bacteria is directly linked to what we call endothelial dysfunction. So we used to think high blood pressure and high cholesterol were causing these problems. We now know that the high blood pressure, high cholesterol are a result of this endothelial dysfunction, or think of it as like a tear, basically, in these little arteries. And one of the things that causes that are the toxins given off by oral bacteria. And so we can give you blood pressure medication and cholesterol lowering medication, but we're not actually, fixing the problem. And the coolest thing about my job is the mouth is very accessible, right? It's a lot easier to treat the mouth than to go in and treat, arterial disease. The thing about dementia, most of Alzheimer's treatments are directed at these amyloid plaques. Well, what we know now, the plaques are actually protective. So when a bacteria gives off toxins, it activates the immune cells up in the brain. And as a protective mechanism, we create these plaques. And it's kind of like a cyst or like an encapsulation of these toxins. So when we go after the plaque, we're never the same thing. It's the same thing like going after the blood pressure, right? We're not actually getting the problem. So we want to reduce this bacteria. We know too, when you think of anxiety, and again, we talked about mental health earlier, so much of that we know now is related to a dysbiosis or an imbalance in the gut. Now we have really cool, easy saliva tests, right? Again, not every kid wants to do a stool test, right? But you can get them to do a saliva test, and that will really show us. The one that I like using looks at 700 different species, right? So we can see, do they have beneficial bacteria? Do they have pathogenic bacteria? Do they have the ones that cause bad breath or a gut health impact? Which is really great because, we can just throw at you, again, like throw you at fluoride or make you use this mouth rinse. But until we really understand, we don't want to be killing things. We want to create balance. So it's important to understand, how can we, instead of trying to just kill the bad, how do we regrow the good? We want an oxygenated, pH neutral environment in the mouth, loaded with minerals and vitamins. So those are the really key components for moms to be thinking about nutrition wise. It's not about what we don't want, but what do we want to ensure that stays really good.
Now let's chat about the role of clean, non-toxic products. So many of us never read the labels on our toothpaste or mouthwash, but conventional products often contain artificial sweeteners and dyes and chemicals that really disrupt the oral microbiome. So what should people look for in safe, effective oral care products? And why do you believe natural options like Primal Life Organics are part of the solution?
So Primal Life is one of my favorite because it is all based on, natural products. And even so people say, okay, I'm going to switch to a natural toothpaste, but 90% of natural toothpaste still contain things like xylitol and sorbitol. So anything with that TOL at the end is a sugar alcohol. And we know over time that also disrupts the gut microbiome. And there's tons of research showing how xylitol, one of the very popular nasal sprays is xylitol. And okay, but again, we're killing something. So you have an acute issue, that's fine, but we never want to use those things long term because it causes a further imbalance. So what does the teeth need? What do healthy bacteria need? They need oxygen. They need minerals like calcium and phosphate and magnesium. Those are really important. They need the fat soluble vitamins. So that's vitamin D, vitamin E, vitamin A, and vitamin K. Those fat soluble vitamins and the minerals in combination is what creates healthy tooth structure, healthy fluid flow. So we want to look for products that have, like Primal Life has a clay base because that is where the minerals are. Right. Some of them have a hydroxyapatite, which is, again, minerals, right? So we want to look for those products that are loaded with vitamins and minerals and have no sweeteners at all. If you have a little bit of stevia, that may be better than most, but again, if we can avoid those kind of sweeteners, and there aren't that many products out there. So you really want to read the labels carefully. Every time I get a new product, they'll send me stuff and I'll look at it and be like, oh, so close, and then there's just that one ingredient. Like we said, there are too many toxins. We've got to pick our body care products very, very carefully to avoid all of the dyes and chemicals. I don't believe in mouthwash. You do not need mouthwash. If you feel like you need to rinse it, just take simple old hydrogen peroxide, dilute it 50-50, use that occasionally. You don't want to do that every day either because, again, that has a killing action too. But it's more natural than, say, some of those colored mouthwashes that are alcohol-based or, again, just flat out chemicals.
Yeah, that's such a simple but powerful change. And switching to clean products that actually support, not sabotage our health, is really
Yes.
a very simple thing. So, information is power. We've been talking about this for the last 20 minutes, but action is what protects our families. So, if you could give parents a short checklist of things to start doing today to protect their families, their oral health, their overall health, what would that be?
Nasal breathing, that's one of the most important things in my mind. Making sure your child is getting a balanced diet. And even though we think we're eating really well, I still think everyone from age 0 to 100 needs to be on mineral supplementation, because we're really missing that in our food supply today, because the soil has become so deficient. So a mineral supplement, those fat soluble vitamins I touched. Some of my favorite things are just plain old cod liver oil. The things our grandparents used to use, that has fallen out of favor, right? You've heard the saying, if your grandmother wouldn't recognize the ingredients on the label, don't eat it. So cod liver oil has the natural forms of vitamin D, vitamin A. Vitamin A is really important in getting the minerals into hard structures like your bone and your teeth. So I really like cod liver oil. And for the vitamin K, if you have a good grass-fed butter that's really yellow, or you get pastured eggs, that really yellow yolk, that's loaded with the vitamin K, that we know is absolutely vital, again, to make sure those minerals get into the teeth and the bones versus precipitating out into like tartar on the teeth or, plaque in the arteries. So,
Wow.
Those are my three main things.
Well, that's a great roadmap for us moms and for everyone listening and the dads right now, because these are all easy, actionable steps that we can all start doing today. So thank you so much. I learned so much during this interview. Thank you for being our expert on the microphone.
Oh, thank you so much for having me.
For our listeners, if you want to learn more about biologic dentistry and clean, non-toxic oral care, you can visit PrimalLifeOrganics.com, and you can connect with Society Brands for their ongoing clean living initiatives. You should definitely follow Dr. Rachaele Carver's work and podcast, The Root of the Matter, on all streaming platforms. Our kids' health matters. Our own health matters. And as we've heard today, that starts with us. And you can visit CarverFamilyDentistry.com. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. This was the Clean Collective segment brought to you by Society Brands and Primal Life Organic. We'll be right back after this.
A Moment of Zen is brought to you by Primal Life Organics. Still brushing with chemical paste and fluoride-era formulas? Upgrade to Primal Life's tooth powder, powered by enamel-building nano-hydroxyapatite and real organic cinnamon oil to naturally whiten, strengthen, and restore your mouth's mineral balance. No foam, no dyes, just science-backed minerals that really work. Cleaner, whiter, stronger. That's the Primal Life promise. Visit PrimalLifeOrganics.com/Zen for 15% off. Detox your smile today.